Welcome! Today, we're going to demystify a condition that so many people deal with, generalized anxiety disorder. We're going to break down what it is, how it's diagnosed, and maybe most importantly, talk about the real-world strategies that help people move from that feeling of constant worry toward a place of wellness. You know that feeling? A constant, looping series of worries that you just can't seem to shut off? For a lot of people, this isn't just a bit of everyday stress. It's the very core of what it feels like to live with GAD. So what exactly is generalized anxiety disorder, or GAD? Well, the key thing here isn't that you worry about one specific big event. GAD is all about a persistent and, this is the important part, uncontrollable worry about a whole bunch of different things. Work, health, money, and it has to be going on for a long time. Okay, so what does that worry actually look and feel like in day-to-day life? Let's really get into the symptoms and explore where this condition might even come from in the first place.
What's so interesting about GAD is that it's a whole body experience. It is not just in your head. I mean, of course you have the mental symptoms we'd expect, that constant worry, those intrusive thoughts, but the body really does keep the score, and it shows up with very real, very physical symptoms like fatigue, constant muscle tension, headaches, and even stomach issues.
So where does GAD come from? Well, there isn't some single anxiety button in the brain. It's actually a really complex mix of different factors. Part of it can be genetic, it can be linked to how your brain chemicals like serotonin and GABA are working, and it's often triggered or made worse by long-term stress or really difficult life events. So, how do we get from that internal, overwhelming feeling of worry to an actual clear diagnosis? That's the critical bridge, right? It's the step you have to take to get effective help.
And this is the big question, isn't it? We all get stressed, we all worry. So where do you draw the line? The entire diagnostic process is basically designed to answer that exact question. A GAD diagnosis isn't just a hunch. It follows a really clear three-part checklist. First, there's the duration. The worry has to be happening on most days for at least 6 months. Second, you have to have those associated symptoms we just talked about. And third, and this is so crucial, it has to have a real impact. The anxiety has to be significant enough to actually disrupt your daily life. And that second key, the number of symptoms, it actually has a specific threshold. For an adult to be diagnosed with GAD, they need to have at least 3 of those physical or mental symptoms, like restlessness or fatigue, on top of the constant worry. A proper diagnosis is also a process of elimination. Before a healthcare provider settles on GAD, they'll usually run tests to make absolutely sure the symptoms aren't being caused by something else entirely, like a thyroid problem, or even the effects of too much caffeine. Okay, understanding the problem and how it's identified is a huge first step. But now, let's turn to the most hopeful part of all this, the toolkit for managing GAD and really finding a path forward. Yeah, when it comes to treatment, there's no single magic bullet. The most effective strategy is a combined one. It almost always includes psychotherapy, especially something called cognitive behavioral therapy, or CBT. This is a really practical, hands-on therapy that helps you learn to challenge and change the thought patterns that keep that anxiety cycle going. And for many people, that's combined with medication. Okay, let's walk through the main medication options here. I want you to focus on the top 2 rows, SSRIs and SNRIs. These are the go-to, first-line treatments. Why? Because they're effective and generally people tolerate them well. Now, compare that to the row for benzodiazepines. See the key feature? Rapid relief. Sounds great, but the big flashing warning sign is for short-term use only because of that high risk of dependency.
So the strategy is actually pretty clear. Doctors almost always start with SSRIs or SNRIs. They just offer the best balance of safety and effectiveness. Plus, they can also treat depression, which, as you can imagine, often goes hand in hand with GAD. The other meds are usually considered second line. They're for specific situations where those first choices just aren't working out. It is so important to underline this point. While benzodiazepines can feel like a lifesaver in a crisis, they are not a long-term solution. The risk of dependence is very real, which is exactly why their use is strictly limited to very short-term, supervised situations. So, with all that in mind, what does the future look like when you're managing GAD? Let's talk about the long-term journey and what the prognosis is. This is a really important expectation to set right from the beginning. For many people, GAD isn't something that's cured in a couple of weeks. It's often a chronic condition.
That just means it's about learning to manage it over the long haul, kind of like you would with any other chronic health issue.
So, while GAD can be persistent, the real takeaway here is that the outlook is actually very positive with the right approach. Things like getting an early diagnosis, staying consistent with your treatment plan, and maybe most importantly of all, engaging in therapy to build those lasting coping skills, all of those things are proven to lead to much, much better outcomes.
We've covered the what, the why, and the how. So we want to leave you with this question. Whether this is for you or for someone you're trying to support, just knowing this toolkit exists is incredibly empowering. So think about it. What's one small step you can take, maybe starting today, to move from a place of worry toward a place of wellness?